Good morning, everyone. Welcome to the fourth session of the Tennessee Healthcare Campaign series on achieving health equity for all Tennesseans in a time of change. I'm Randall Rice, the president of the board at Tennessee Healthcare Campaign. Since 1989, we've worked towards our vision that all Tennesseans will have affordable, high quality, and equitable access to healthcare. The THCC advocates for policies and programs that improve the health and well-being of Tennesseans. The program today is what are the prospects for closing the coverage gap in Tennessee in 2021 and beyond? Is there a new way forward? Dr. Carol Myers, whom you will meet later, agreed to design and present the program along with several other distinguished participants. The thought being that we've advocated for closing the gap in coverage for low-income citizens for many years without success. Is there a different way to achieve this goal? We'll hear different perspectives today and maybe see new or different possibilities. I want to express our gratitude to our presenters for taking time and the effort to be with us today and sharing your information. Again, welcome to the conference and thank you for your interest and support. Now to get us going, I want to introduce our moderator for today. Tina Franklin is Vice President of Health Equity and Stakeholder Engagement at the national organization Health Leads. Tina provides strategic, operational, and organizational leadership that grows capacity for intercultural competence, nurturance of diverse populations, and inclusive leadership across the organization. She consults on community engagement and public health strategic approaches to addressing health equity in local communities. Prior to joining Health Leads, Tanae served as the director of the Tennessee Department of Health, Office of Minority Health and Disparities Elimination. In this position, Franklin was responsible for promoting continuous improvement for disparities elimination by enabling cooperation and collaboration among minority communities and disparate populations with the Tennessee Department of Health Programs and Services. Under Tanae's leadership, the OMHDE helped other Tennessee Department of Health divisions, offices, and agencies identify, assess, and address health disparities. The office also provided oversight and guidance for the Office of Faith-Based Health Initiatives that engaged faith community organizations to help address health disparities in their communities. Tanae is active in her community through a myriad of volunteer and advocacy efforts. She's the vice chair of the Metro Public Health Department in Nashville, Tennessee, and supports the Council on Black Health. Southeastern Health Equity Council, Tennessee State NAACP Health Chair, and Delta Sigma Theta Sorority, Inc. Tanae is a native of Chattanooga, Tennessee, holds a master's degree in genetic counseling from Howard University, and a bachelor's degree in biology from the University of Virginia. She lives with her husband and two daughters in Nashville, Tennessee. Tanae?
Thank you, Randall. It is an honor to be here again amongst friends and the Tennessee Healthcare Campaign family. I see familiar faces and names on the call, and I'm looking forward to us having a robust dialogue today as we focus on the prospects for closing the coverage gap in Tennessee. So what is the way forward? Is there a new way forward? So the expansion of Medicaid, which is a joint federal and state program, has been discussed and thwarted numerous times in Tennessee. And as we transition to the new administration, Governor Bill Lee continues his term, and the 112th session of the Tennessee General Assembly is convened. And we also have COVID that we're dealing with. So what does this mean for the 280 Tennesseans with regards to the coverage gap? So today we have an opportunity to hear from subject matter experts from across the state. I look forward for us asking questions amongst each other and having a dialogue. Our total webinar is going to last about 2 hours. And before we get started in our conversation, I just wanted to remind us of a few logistics. If you have questions, please enter your questions in the chat box. Please try to remain on mute. If we have an opportunity, we will recognize individuals to come off mute and ask questions later. So let's jump right in. And I'm going to start with introductions. So first, joining us, our first panelist is Dr. Katie Cahill. Dr. Cahill is the Associate Director of the Howard H. Baker Jr. Center for Public Policy at the University of Tennessee. She's the Director of the Center's Leadership and Governance Program and holds a courtesy appointment as an Assistant Professor in the Department of Political Science. She also holds a PhD from Purdue University, and her expertise is in health policy. Dr. Cahill is a member of the steering committee for the interdisciplinary COVID-19 outbreak response expert team, and also leads the collection and analysis of the Tennessee Pulse Survey in partnership with Governor Bill Lee's Economic Recovery Group. She also serves on the steering committee for President Randy Boyd's newly announced Substance Misuse and Addiction Resource for Tennessee Policy Network, and is the principal investigator for the Healthy Appalachia Project in partnership with Remote Area Medical, or RAM. Dr. Carol Myers, is the professor in the University of Tennessee College of Nursing, where she teaches graduate level health policy and health services courses and coordinates an interdisciplinary graduate certificate program in health policy. Dr. Myers is the leader in the use of policy, advocacy, and media to promote population health, including healthcare access, rural health, Medicaid, and APRN Full Practice Authority. She conducts research that centers on policymaking and health services with an emphasis on access to care, TennCare, public health, and advanced practice registered nurses. Myers is the creator and co-host of Health Connections, a radio show on WUOT, the Knoxville NPR affiliate. Dr. Myers also blogs, is an avid tweeter, and author of op-eds and other commentaries. Dr. Myers is a fellow in the American Academy of Nursing, senior fellow at the Center for Health Policy and Media Engagement at George Washington University, and faculty policy fellow with the American Association of the Colleges of Nursing. Ms. Katina Beard has deep experience in public health and a deep passion for increasing access in underserved communities. After taking on increasingly responsible roles with the nonprofit healthcare agency, Matthew Walker Comprehensive Health Center, she was tapped as the interim CEO in 2014, with the position being made permanent the following year. Ms. Beard is active in research and reducing health disparities. She serves on the Precision Medicine and Health Disparities Collaborative Advisory Board, the Meharry Vanderbilt Community Engagement Research Corps, Tennessee Center for Health Workforce Development, and is the past chair of the Nashville Health Disparities Coalition, and currently serves as the chair of the Tennessee Primary Care Association. Ms. Beard earned her undergraduate degree in healthcare administration and planning from Tennessee State University and her master's degree in public health from Meharry. The Honorable Jeff Tibbles is born and raised in Scott County, Tennessee, graduated from the University of Memphis with a degree in mechanical engineering. And I was interested to hear and surprised to learn that Honorable Jeff Tribble served as NASA's Space Shuttle Program as a cryogenics system engineer and firing room operator during the mid to late 80s. He was actually in the firing room the day that Challenger exploded on January 28, 1986. Employed briefly as a manufacturing engineer at Hartco Flooring Company until 1991, he became a business owner for 11 years and also running the Crooked Creek Golf Course. Mr. Tribbles attended the University of Tennessee Teacher 2000 program and taught our high school students mathematics from 2001 to 2010. Elected Scott County Mayor from 2010 to 2014, and again, he currently serves as Mayor of Scott County, most recently being elected in 2018. He has served as the Oneida City Council Alderman, Oneida Water Board, on the Oneida Water Board, Oneida Planning Commission, and other local boards. And presently, he is serving on Governor Lee's Healthcare Modernization Task Force. So let's get started with our conversation. So each of our panelists will have approximately 10 to 12 minutes for their presentations and remarks, and then we will then move on to the question and answer period. So I'm going to turn it over to Dr. Katie Cahill.